called an MTHFR deficiency. But a lot of people ask about this, and I thought I had actually done a video about it, but apparently I haven't. I've written about it in some of the blog posts I have on darkmuscles.com. If you haven't gone there and check it out, and follow me there. In the blog post, we talk about neuropathy, and we talk about MTHFR deficiency and how it plays a role there. The MTHFR gene mutation is quite complex, and it is involved in the metabolism of cysteine and homocysteine, and I'll explain that in just a second as to what that means. But I wanted to talk about it because I know a number of people have asked me about it and how that relates to glutathione and oxidation, or using antioxidants and things of that nature. So let me start out briefly and give you a slide set to look at. Let me share my screen here. I'm going to open this up here, and so this is probably small on your screen if you're on your phone, especially. But this is the metabolism of homocysteine. This little process right here, and I hope you can see my mouse. Homocysteine is key, as it is an amino acid that the body makes. And it's the body takes methionine, which you can get from eggs and meat and things of that nature, and it converts it into homocysteine. Then using B6, it's actually turned into cysteine, and this is important because cysteine can be sulfated and can be used to create proteins and structure of cell and muscle and skin and hair, things of that nature. And it can also be used in the formation of glutathione. Glutathione is made up of cysteine, glutamate, and glycine, and it's actually that structure of those three elements together, that amino acid, actually is an antioxidant, meaning it deoxidizes free radicals and things like that. As your mitochondria, if you think about your mitochondria as one of the engine of the cell, every engine in your cell produces a byproduct. Like your car, when it burns gas, produces exhaust. Well, those exhausts can be damaging to cells and can cause cancer if they build up in levels. You get what are called superoxides, or oxygen that have extra electrons on them, and glutathione actually decreases it, kind of binds those up and activates them and then dumps them out. In order to do that in an important way, the challenge is you have to convert homocysteine into cysteine. And so that's the issue that arises. So what I want you to see here is that your body's taking methionine, it's converting it into homocysteine, and then it converts it into cysteine. If you have trouble with B6, if you don't have B6 as a vitamin, which is called pyridoxine, you don't make cysteine very well. If you overproduce homocysteine because you took in a lot of methionine, your body will actually convert that, and it has two pathways that can convert it. One is converted through methionine synthetase, and the other one is converted through a separate pathway using betaine and converting it that way. It can convert it either way. The interesting thing I find, and what I see a predominance of in my practice, is that about 50 to 60% of the diabetics that I see in my office have a deficiency in their ability to make and methylate this tetrahydrofolic acid. So in order to convert the homocysteine back into methionine and to cycle it correctly, your body takes folic acid. This little, I know you can probably not see my mouse very effectively, but it's right here. Takes folic acid, converts it through what's called an MTHFR, which is the methyl tetrahydrofolic acid reductase enzyme, also using B2, and that pulls that through and then allows it to convert homocysteine correctly. If you have a genetic variant, and about 50% of the population has this variant, and about 60% of my diabetics have this variant, where they don't fully methylate their folic acid correctly, or it's inactive in some degree, you have two genes that create this MTHFR enzyme, and if one or both of them are not functioning correctly, you'll actually not methylate homocysteine effectively, and you can build up homocysteine. Now, building up a homocysteine can cause fatigue, muscle ache, brain fog, all sorts of things like that. And so it can, and the main thing I see early on before a person's ever diabetic is neuropathy, what they call polyneuropathy or idiopathic neuropathy. And then 5 to 10 years later down the road, the person becomes a diabetic. Well, what's happening is they have this genetic allele that's not letting them function correctly. And the gene is this CT, it's called a C67, let me plug it in here. I've got it right here. It's called the C677T genetic, let me see if I can pull it in there. The C677T gene mutation is the most common that we see. And there's another one that can happen too, but both of these can play a role with neuropathy in the feet. Now, this cycle is combined with 2 other cycles, and it's very complex. And so tonight I thought I'd just talk about this specifically, and then we'll go back and we can talk about glutathione and how it works and things of that nature. I know a lot of people have asked me questions about that. But what I commonly see, and one of the reasons that I designed my multivitamin was because if you don't genetically convert this folic acid correctly, we can actually give you the methylated form. We can give you this 5-methyl THF, which is it's L5-methyl THF is the fancy term, or L-methylfolate's the other way it's called. Well, if we give that to you, you can actually increase this process and actually notably diminish the neuropathy, and then also make a more efficient methylation process for making glutathione and improving overall cell structure, aging, anti-aging effects, and improvement of the mitochondrial function. I have a lot of people that have mitochondrial dysfunction. Fibromyalgia is an issue. Lyme disease is an issue. A lot of these people that have these chronic fatigue, chronic pain problems, even migraine headaches, are related to mitochondrial dysfunction. And this is one of the key factors that happens in that process. So making sure that you have appropriately methylated folic acid, and it's a blood test called the MTHFR gene test that you can check this with. Some people will have borderline homocysteine levels, borderline normal or high. And you can also have this deficiency if you're not converting your MMA correctly, which is another issue. And we can talk about that in a separate section. Oftentimes when we see anemia or borderline anemia, that's related to either B12 or folic acid, or both of them being inappropriately used. In the case that I see in my office, the majority of the time it's related to poor use of folic acid or poor methylation of folic acid in the office in the population that I deal with, and that leads to poor glutathione creation and things of that nature. So and there's reasons for that. I won't go into that tonight because it's a very intense, long presentation. So I thought I'd just touch on the component of MTHFR tonight and answer a couple questions. I realize it's late, and yes, I do sleep. Somebody asked, but that's the story there. So let me hide that there and answer some questions here and pull this back up on the screen. I can get it up here. So I'll just put up here that about 50% of the population has this gene variant of the MTHFR, and about 60% of those with diabetes have it. The majority of my patients with polyneuropathy, whether it's before they're diabetic, pre-diabetic, or diabetic, have significant improvement with this once we give them the methylated form of folic acid. So hopefully that gives you a little insight into what we were talking about, and a couple of people asked before. Let's see. Let me just answer some questions. I realize it's late tonight. Good evening. Hello, Karen. It's good to see you. Hey, Dan. And there's Kathy and Michelle and Chris. All right, let's see here. Glad you're here tonight. Love all the information. Thanks for taking the time. Thank you, Patty. I appreciate that. Hello, Annette from Vancouver. We'll watch this tomorrow. So need this talk. Important, and I'm going to kind of expand on it because there's so much to it. It's hard to do it in a little blip. So I thought I would take it about 4 or 5 minutes and explain each step. Right now, I'll talk about the MTHFR piece and touch on mitochondrial dysfunction because I see so much of that in my office and how this works. Jennifer has the other one. She's got the A1298C. Now, what that means is that the A amino acid is substituted for a C. If you have the other one called C677T, you're substituting a T for a C in the gene structure. And so there's 2 different variants. Jennifer has the A. That's less common, where and some people have both of them. Those are called homozygotes or heterozygotes, where they're opposites. You can have homozygotes where you have 2 of the same gene mutations instead of 2 variants. And the challenge is that either of them can cause and lead to neuropathy. They can lead to anxiety. They can lead to depression, and in severe cases, even schizophrenia. So we want to make sure that if you have it, it's being treated. In most cases, it doesn't progress to that, but a lot of my patients, as they progress down the road of diabetes and their insulin level goes up because they're not methylating correctly, and because of the higher inflammatory pathways that are occurring and the glutathione can't keep up, because of another pathway through homocysteine, they actually see it worsening neuropathy that arises. So some very powerful things that can happen there. I suffer badly with neuropathy in my feet, and no one's been able to help. I take methyl B12. See, now this is the problem, Carrie Ann. A lot of people say, well, it's methylation, so they give you methylated B12. But if you notice in that cycle, and I'll pop it back up here on the stream, methylated B12 affects this area right here. That's downstream from where the damage is. The damage is usually at the MTHFR section, where you have one of the two variants, either the C67T variant, or as Jennifer talked about, the A1298C variant. You don't need to remember all the fancy terms and acronyms. Just remember there are two. There we go. Fingers on the camera. There are two variants that are there, and if you have one of them, giving you methylated B12 will do you nothing. It doesn't do you any good. It's upstream from that in that conversion process where we have to give you the pre-methylated folic acid, because there's no way to bypass. If your gene just doesn't make the enzyme that works correctly, we have to give it to you. And the amazing thing is we can give it to you in a pre-methylated form of the vitamin, not B12, but folic acid. And if we over-methylate your B12, that can cause other problems on a flip side, and actually make things worse in other cases. So if you don't need methylated B12, you shouldn't take it. If you don't need methylated folic acid, you shouldn't take it, because there's some binding issues that happen. But if you need it, we got to give it to you, if that makes sense. So hopefully that'll give you some insight there. And it's a very simple blood test that can be done through blood draw. Do the 23andMe test. Yes, 23andMe does check for the MTHFR variant. It's one of the 23 variants they look for in that process. So that's one way to get it checked. Hello, Crystal. It's good to see you. They told me I'm high risk of type 2 diabetes. And Michelle, if you're high risk for type 2 diabetes, then you are pre-diabetic. And like I said, 60% of my pre-diabetic patients that I see in my office have one of these mutations. And that can lead to the neuropathy that we see in a lot of people. Hello, Kathleen, and hello, Carrie Ann. Does your vitamin have both? So what my vitamin has is it's about a 50-50 mix of L-methylfolate and regular folic acid. So it's not a huge amount of methylated folate. If I give you regular folic acid and your body doesn't convert it, it just dumps it. But if I give you too much methylated folic acid and you don't need it, I can actually make some other symptoms worse. So we give a small amount of methylation of folic acid and regular folic acid. You get both regular folate and methylated folic acid, and that seems to be effective. Sometimes you need more. We start around 400 micrograms, and we work all the way up to sometimes 15 milligrams, which is essentially 15,000 micrograms, if you know your metrics. And so we start low and we work our way up. If we start with too much and you don't need it, we can over-methylate you, and that can cause some other problems on the flip side. Let's see. Mine said typical likelihood vague. I don't know what that means, Lucy. Let's see. It can be numbing. Yeah, it can be numbing. So Dennis, the numbing part is that if you have the MTHFR variant, 50 to 60% of those people can and may have progressive polyneuropathy or numbness in the feet. And in some cases, the hands and fingers too, depending on how significant it can be. This neuropathy can then lead to an elevated homocysteine level, which can also cause joint aches, pains, muscle aches, and even some cognitive deficiencies, as well as anxiety, depression, and in severe cases, schizophrenia. So it can be numbing both in the feet and the mind. In that regard, depending on the severity, and most of the cases that I see are mild because there's only one or two variants, and because the body can process homocysteine through a second pathway, we don't always see the really high homocysteine levels that we see in other people that have both pathways broken, if that makes sense. I realize I'm talking about literally 3 or 4 different cyclic pathways within the cell itself and in the mitochondria of every cell of the body. Is neuropathy due to inflammation and or prediabetes? It absolutely is. It's actually due to both. The prediabetes and the high insulin response drives the inflammation. And then if you have one of these gene variants, that actually adds to the likelihood that you have the neuropathy. And Linda, I hope that answers that question. You are very welcome. You're homozygous for C677T. So what that means is that, Julie, you have, there are 2 genes, and both of your genes have a variant of the most common mutation, which means that both of your genes are only 50% effective, which means that in general, you're probably down by about 25 to 50% of the overall activity of those genes, and you're likely to have or a person with that is more likely to have neuropathy because both genes are mutated and both of them are not functioning with folic acid correctly, if that makes sense. When we very simply substitute the L-methylfolate, it actually improves this by 50 to 60%. Sending you smiles and love to the family. Oh, cool. Thanks, Steph. Oh, Stephanie. Hey, Steph, how are you? It's good to see you. Thanks for joining in on the other side of the world. How do you test for this? Because the genealogy sites won't do it. Well, Robin, it's just a blood test. It's very simply a blood test. Oops, you just get your blood tested, and it's very, very simple. Chris says, I need this too. I'm health and wellness. I found out a year ago I have the double C677T homozygous gene. So the pure genomics may have the methylated folic acid in. I think it does, but you'll have to check, Crystal. I don't know for sure on that one. Hello, Chad in Canada. She dislikes taking pills. Do you know if the B12 shots do? So B12 shots do not solve this problem, Jennifer. The B12 shot is just cyanocobalamin, and it ramps up, it pushes B12 up high enough that if I push enough B12 into your system, it will push some of that B12 into the cell. There is some push into the cell, and so you'll get some B12 effect in that conversion process, and it may help for a week or two. That's why a lot of people that tell me they get B12 shots, they feel good for the first week, and then they feel bad for the next 3 weeks. The problem is not the B12. The problem is the precursor molecule to helping B12 work efficiently to convert that homocysteine. So the challenge is it's literally the form of folic acid. So B12 and folic acid are essential in this process. You get both of them through eggs and through fish and through beef liver and things of that nature. Your folic acid comes through leafy greens as well. And so, but the problem is if you can't convert your folic acid, then we need to give you the methylated form. And the methylated form comes in the form, unfortunately, in the form of a vitamin. There is a small amount of methylated folic acid, I think, in leafy greens, but it's not nearly enough to really, truly help a lot of people. Does it matter if it's the bottom or top of your feet? No, it doesn't, Robin. It can be either. 23andMe said my type 2 risk was typical. That's talking about 2 other genes, actually 3 other genes there. You'll have to look to see if the MTHFR component is listed in there. And it usually is, if you have that variant or not. What lab test will let us know? You actually have to order an MTHFR test. So let me flip this back up on the screen here so you can see it. So you actually have to go to your doc and have them order this MTHFR test to look for an MTHFR deficiency. It stands for methyl tetrahydrofolic acid reductase. Fancy term, say that fast 10 times. All right, let's see. Where am I at here? Oh, I lost my position. Well, where did it go? Oh, it disappeared. Okay. Let's see. I need this too. Found out a year ago you had the, oh wait, that was way back there. Let's see. Okay, what type of doctor do I need to see? I'm a family doctor. Not all family doctors order this test, Dennis, but many of them do. The challenge is many insurances pay for it, but some may not. And this test can run anywhere from $100 to $300. So you may want to check to make sure insurance covers it. But if you have neuropathy in the feet, if you have anxiety, or you have any B12 deficiency or anemia, it's usually covered. Because those are the 4 most common side effects that arise if this test is off. And then I've had some patients that I ordered the test, it wasn't covered, but because they have the genetic variant, and then we identify that that's causing part of their anemia or their pre-anemia, then the insurance will cover it on the back end. So you may have to work with your doctor if it's not covered. So be aware of that. Sounds like I will have to watch this on the rerun. Yeah, Berkeley, check it out. Now this is going to be one part in a series. This is the first step in a series of talking about antioxidants, glutathione, and those kind of things. And so you've got to have this background in understanding the conversion of methionine to homocysteine and how folic acid and B12 play a role here. So we're looking at this first part of the cycle, which you look back, you can see that. All right. Tara says, I'm heterozygous. So Taryn has a mutation in both the 81298C and the C677T component of that, and that can cause recurrent miscarriage. And if so, is there anything that can help? There can be some relationship to that, and there can be some relationship to vascular disease, which is what causes the miscarriage. Oftentimes, This is where docs start giving folic acid and methylated folic acid so that it helps with this part of it. So that's the key, is that if you were giving you pre-methylated folic acid, and not all prenatal vitamins have the methylated folic acid in it, but one of the things we know is that because of this gene and because of the buildup of homocysteine, it can cause abnormal vascular clotting and changes in the body, and that can predispose to miscarriage. So yes, using methylated folic acid as part of that prenatal would be something that you want to talk to your OB about. Very helpful as always. Well, thank you, Jennifer. I appreciate that. Hopefully it gives some insight. This is a very complex issue, and not many doctors understand it. It's taken me a long time to wrap my head around what it actually does and is and how it works. And I've been testing MTHFR for, I think, as long as I've been doing ketogenic diets, because I see so much neuropathy, and I started seeing so much neuropathy when I came into practice about 20 years ago. This has really truly been one of the big boons that's helped my patients with neuropathy so much. And this was really one of the main drivers that I generated my vitamin, or created my vitamin, was because I couldn't find this methylated folic acid in a vitamin together. And when I tried to have somebody make it for me, they charged me the patient a fortune. They were charging $150 a month for this, and it was just outlandish. Nobody could afford that. So I actually found a company that would actually put the L-methylfolate in a regular multivitamin at a reasonable cost. And so that's why, among other things, that I designed my vitamin. Not that I'm trying to sell my vitamin, but that's really, a lot of people ask me, well, why do you have your own vitamin? It's for this reason alone, because, for this reason plus many others. But this was the true driver behind what's caused me to start looking for my own supplement that I could use myself, with my family, and with my patients. Because this hits my whole family as well. All right, horrible neuropathy in my feet from B12 deficiency, gastric bypass. Nobody told me to watch for this. So at Crystal, nobody knew about it. We didn't really understand this until about 15 years ago. And it wasn't until probably 5 or 6 years ago that we could truly get access to the test through insurance, because insurance wouldn't pay for it because it was a genetic test. Nobody wanted to pay for that. And then just really lastly, since 2013 and 2016, so literally in the last 6 to 9 years, have we had any research showing the correlation between retinopathy, eye damage, and neuropathy, damage in the feet, in relationship to prediabetes, diabetes, and this particular gene mutation. So this is really fairly new, but we've known about the fact that it's been helpful in the last roughly 15 years, just from anecdotal data. So it's not so much the B12 deficiency as it's the poor methylation of folic acid doesn't let your body use the B12 inside the cell, if that makes sense. Hello, Sheena, how are you? Let's see, that is insane. How that gets you. Yes, it is. Thank you for covering this. I had no idea it leads to neuropathy. Yes, there aren't very many doctors not very many doctors dive into genetics, and that's the hard part. It's interesting that, I usually end up focusing on things that I see a lot of, and I've got an interesting practice in that a large percentage of my practice is pre-diabetic or diabetic. And so I see a ton of this, and this is sort of diving into this and really trying to understand the physiology behind it and how to treat it has been a big key in what I do. And that's one of the reasons I do ketogenic diets, is because the ketogenic lifestyle, increasing the eggs and meat and fish and things like that through a ketogenic lifestyle, actually enhances the body's ability to have homocysteine, methionine, folic acid, and B12. The low-fat diets and vegan and vegetarian diets are all deficient in B12. And they have very poor absorption of B6 and poor absorption of folate. And so one of the common things that happens when vegetarians and vegans come into my office is they're all B12 deficient, and most of them don't have enough B6, and they frequently have folic acid deficiency. And then if they have a genetic predisposition to MTHFR, they feel horrible. They have chronic fatigue. They have a mitochondrial dysfunction, and they suffer from chronic pain syndromes and migraine headaches, things like that. And as soon as we change up their diet, they start to feel better, but often not until we fix this MTHFR variant, which many people have, do they truly see full relief in that regard. That was a long-winded answer. When I stay on keto and take proof products, my inflammation goes away. And that's because the inflammation is driven by high insulin responses, Linda. So key to understanding that, it's very important to recognize, which you already have. If no neuropathy but have insulin resistance, do we need to get the MTHFR blood test? It doesn't necessarily relate to Alzheimer's dementia, but if you have, this does highly correlate with retinopathy, so damage in the back of the eyes, glaucoma, There is some correlation there. We don't really know if it's a causation, but there's a correlation. Depression and anxiety are two big ones. So if there's a history of panic attacks, anxiety, or depression, this also relates to that. So that would be a reason we wanted to check it. Let's see. Hey, Jonathan, how are you? They're in Brisbane. It's 2:48 there. It's 9:50 p.m. here. I should probably be going to bed, but I was so excited to talk about this, and I had it's been a long day. Is neuropathy just numbness? So neuropathy is, and I thank you for asking that, Michelle. I should have defined that earlier. So in the feet, you're going to have neuropathy is defined as a numb sensation, numb to light touch, meaning there's two forms of touch. If I just gently touch your hand, when you first touch, that's called light touch. People who have neuropathy start to lose the sensation of light touch. They have firm touch. If you push firm, they can feel it. But if you lightly touch, or I take the pinprick of a needle and lightly touch it against the hand or the feet, they can't feel it very effectively. That's the first stage. The second stage is a burning sensation or a tingling sensation, or a sensation that feels like you're wearing socks when you're not. The third stage, where you start to have damage because of this, is a true burning sensation. Now, it is reversible in many cases. When you've progressed to severe nerve damage, it may not be totally reversible. But if you're having pain, that also is reversible. So neuropathy is defined as loss of light touch, sensation of wearing socks when you're not, and or a burning pain that can occur during the day or at night, if that makes sense. So thank you for asking, because I should have clarified that in the beginning. They had me on crappy gabapentin. Well, gabapentin used to be the only way we treated the burning pain. It didn't treat the numbness, but it treated the burning sensation. And it does diminish it, but it doesn't take it away. And that's the challenge. And gabapentin has a whole slew of side effects because it's an anti-seizure drug. And it works for the severe pain, but it's got its own set of side effects. So you have to weigh the pros and cons on that one. Natalie says, my mom was having neuropathy in her feet. Told her to look into B12. She started taking it so much better. So neuropathy can be driven by a methylated folic acid deficiency. It can be driven by a B12 deficiency. It can be driven by a B6 deficiency. Or you can get neuropathy with B6 toxicity. Usually with folic acid and B12, if you take too much of it, you just dump it out and you create expensive stool. But B6 can actually become toxic. So if you're taking I have a lot of people that take a huge megadose of a B complex. And usually the folic acid and folic acid is B9. B12, usually if those are toxic, if those are megadosed, it's not a big deal. But B6 doesn't clear out of the system very well, and too much B6 can lead to neuropathy also. So something to think about on the flip side with B vitamins. I see that fairly frequently too, because I have a lot of people that, they take this vitamin for their eyes, and they take this vitamin for their kidneys, and they take this vitamin for their liver, and they're all B complexes, and they megadose B6 and they start getting neuropathy. So be careful with that. Be careful, meaning a little bit of a pun in there. All right. Jessica says, Doc, I have dual genetic hemochromatosis and have neuropathy. So the hemochromatosis is a different component altogether, but the neuropathy may be related to, because oftentimes when you have genetic hemochromatosis, you may also have a genetic MTHFR deficiency, or you may have a genetic deficiency of one of the other methylated components, which is another talk we'll talk about on another night. But can it be related? Yes, it can be related. And so what you probably want to do, and if you were my patient, Jessica, I would encourage you to get your genetic allele testing completed so that you can identify which one of those genes is off, and is there something that you can do to supplement to help it. So absolutely, yes, those are things that I would look at. Would the vitamins help with post-herpetic neuropathy? To some degree, if you have the MTHFR deficiency, but post-herpetic neuropathy is damage to the nerves because of the chickenpox or varicella virus. And so a little bit different, but if the MTHFR deficiency is present, it will amplify the neuropathy and make it worse. So that in that case, it would still be something I would check. If treatment's not helping. You are very welcome, Crystal. Hopefully that helps. I found out about my mutations 5 years ago. There aren't really any doctors around that know much about it. I know, Julie, so that's why I'm talking about it. Very few people understand this. Very few people talk about this. I find that when I go give my keto talks, people are more interested in this than they are in the keto stuff, because there's a whole group of people that are affected by this and nobody knows about it. Nobody understands it. It is very complex. this mitochondrial function and how the mitochondria uses these pathways with the B vitamins is very in depth. And oftentimes you have to have a PhD in this stuff to really grasp it. That's why guys like Ben Beekman and those guys are so fascinating, because this is what they do. They study this kind of cool stuff. And so we glean some really important information from understanding on how the mitochondria works, how these B vitamins help support the mitochondria and help work around the antioxidant component and decreasing the inflammation and helping the body clear byproducts that build up like homocysteine and things like that. I hope I'm not going too deep or over everybody's head, but that's essentially what it means. Do I offer virtual consults? Yes, I do. Tara and I do offer them. So you can go to docmuscles.com and click on telehealth, and it'll tell you about them. And if you haven't followed me, click on the subscribe button if it's on YouTube replay, or click on over here somewhere on Facebook. There's the follow Dr. Nally on the Facebook page. So follow me there, and it'll notify you when I go live. And I go live sometime between 7 p.m. and like tonight, 9:30 p.m. Mountain Standard Time. So for those of you on the East Coast, I'm sorry. For those of you in Australia, good morning to you. Hope you're having a great tomorrow. Let's see. I have all those, my eye neuropathy, serious burning, numb, no energy. So Sheena, you got to get your doctor to check these things. Get checked out. Get your doctor to check some blood work. I have thyroid with normal limit. I'm not sure LIW. I don't know what quite that means, Sheena. All right. Don't want to fix me. He likes the money, because low dose thyroid can mess with heart. Sheena, what your doctor probably just may not understand some of the nuances of this, and so I ask him about it. And if he doesn't understand it, show up and say, "I'd like this checked." And oftentimes it'll spur him to look to say, "Is it worth checking or not?" And if you say, "I have these symptoms and this is what I have, I'm interested in having this blood test done, this MTHFR test done. Could you order it for me?" If not, then find another doctor. You are very welcome, Natalie. Oh my gosh, I need to make an appointment with you. Yes, we'll schedule an appointment, guys. Let's see here. I don't know about MTHFR until daughter had a miscarriage. Oh, Gail, yeah, very true. Get that checked out. All right, guys, great questions. Like I said, this is a deep concept, and it's late at night, so I'm surprised some of you are still awake. I was doing charts and realized I didn't live stream yet, and I hadn't talked about MTHFR, and I wanted to make sure I had a couple slides up so you could see that and some information, so you could, because this is a hard concept to grasp. It really is not an easy what's the term? It's not an easy concept to wrap your head around. So, and I'm going to pop this slide up here again so you can see it. So this is and I'm going to take. Could you hear me? You know what? I'm sorry, guys. When I switch to that screen, it turns off the sound. Forgot about that. No sound. Lost it. All right. Let me go back to that. I'm going to switch back here. So let me hide that one, and I'm going to come back to here. All right. So let me say that one more time. For those of you that went to sleep for about 3 seconds, 3 minutes, 2 minutes. Let me go back to it here. Shout a little louder. Actually, what happens is when I take myself off the screen, it turns off my mic, because the mic's not activated for the shared screen, which I forgot to do. So I apologize. So that was a good time to sing yourself to sleep, go get something to drink, use the bathroom. That was the intermission. So let me say that one more time. The problem is here. This MTHFR enzyme right here under the B2, the gene that encodes for that is broken, and or only 50% active. And there are 2 genes, and either one or both genes can be partially inactive or broken. They don't convert they don't bind, they don't convert the L-methylfolate to be allowed to be bound to the B12 right here. And then that's required for this enzyme called methionine synthetase to synthesize homocysteine back into methionine. And if you can't do that, it builds up the homocysteine, sucks up the B6 because of its conversion to cysteine. And because of that, the nerves stop functioning and the retina stops functioning, and you can see increased anxiety and depression. That's what you missed in the intermission while I was gone for a minute. So hopefully that clarifies it. So that's a recap of what we just said. Go back and watch the first part of this if you just joined in and just missed it. So hopefully you can still hear me and all is well. All right, so let me go back and take a look here. See, Sheena says, I have 6 years worth of blood work because of the symptoms. I believe you do, Sheena. I'm not surprised. Nisha drifted off. Did you fall asleep for a moment? Let's see here. Hopefully you can now hear me. All right, let me see. That's the lost sound. Does PQQ supplement help with your mitochondria? I don't know what PQQ is. You'll have to explain. That is an acronym that I am not familiar with there, Russ, so maybe you can clarify it. This is amazing, actually exciting. It is, Sheena, it's pretty exciting. Shout a little louder. Okay, hopefully you can hear me now. Gail, I did shout a little louder. All right. Well, you guys, that's it for the evening. I'm going to close that out. About 36 minutes of information. Hopefully it didn't give you an overload, but maybe you'll go to sleep tonight and you'll dream about methylating your folic acid, because I do some nights. So, all right, I will sign off now. Tomorrow, I think what we'll do is we'll talk about glutathione and how, and this is the teaser. We're going to talk about how this homocysteine right here, when it's converted appropriately, is converted into the cysteine and then into what's called glutathione, which helps with your mitochondrial function and helps with mitochondrial dysfunction. So that'll be part 2 of this tomorrow, and we'll have some exciting talk. So you guys have a great night. Drift off to sleep thinking about L-methylfolate and repeating aloud MTHFR dysfunction 10 times. That'll probably put you to sleep. It puts my wife to sleep. As we lay down to sleep, and I start telling her about MTHFR dysfunctions and B12 and cyanocobalamin, she just drifts off to sleep. So works pretty good. You guys have a great night. Remember, keep the fat high, keep the carbs low, pass the bacon, and methylate your folic acid. And we'll talk to you tomorrow. Take care, guys. Good night.